Good morning, and thank you for joining us for our weekly COVID-19 update. My name is Don Walker. I'm Communications Director for Brevard County Government. And on our panel today, we have Maria Stahl, who is the Administrator for the Department of Health Brevard. We have John Davis, who is the Community Health Director for DOH Brevard. We have John Scott, our Emergency Management Director. Matt Wallace, who is our Public Safety Director. And as always, we have Jessie Ray, our social media specialist, with us today, and she will be monitoring your comments and questions during our updates, and we'll pose questions to our panelists once we have completed our updates. Oh, I also forgot we have Catherine Allen, who is the Senior Coordinator with Brevard Public Schools, who is also here today. I apologize for the oversight. All right, so we will start off as we usually do with an update from the Department of Health. John?
Yeah, good morning. Thanks, Don. So cases continue to drop, so that's the good news. We're seeing about 450 less cases week to week over the last 2 weeks running. So we're heading in the right direction. I think today when the state weekly summary comes out, you're going to see that we still are over 100 cases per 100,000 for our rate. So that means we're still a community of high transmission. So because of that, we urge the public to continue to mask when you're in public indoor settings. Please seek vaccination if you haven't done so already. Hand hygiene, social distancing, those things that we know work, and we continue to encourage that. In order to get to an area where we're considered in low transmission, you're looking at less than 10 cases per 100,000. So we do have a ways to go yet. But again, we're seeing positive trends in terms of the reduction of disease. Our hospitals continue to see a reduction in the number of new COVID positive admits. Schools have certainly seen a dramatic decrease in the number of positive cases and consequently the number of those students quarantined. Deaths have dropped over the last week. You can follow that trending on data.cdc.gov. In terms of vaccination, unfortunately, we haven't moved much there. We're pretty stagnant with where we're at right now. So the total county population is 59% vaccinated. Of those vaccine eligible, meaning age 12 and above, the county's at 67% vaccinated at this point. So I do want to urge those that haven't been vaccinated to please seek that out. There's many areas in our community, businesses that are providing the vaccine as well as the health department. You can certainly go to our website, brevard.floridahealth.gov, and all the vaccine information's on there, our hours, and we are testing as well. So for those folks that need testing, you can certainly go to that site and make an appointment. Vaccines, you don't have to have an appointment. You can just show up. In terms of the booster dose, so as most folks know, Pfizer was approved for booster dose for those that are 65 and above, ages 18 to 65. If those folks are living in a long-term care facility, have underlying medical conditions, work in high-risk settings, or live in high-risk settings, they can get the booster dose. In terms of the Moderna, that's still only approved for those that are have immune-compromised conditions. So again, just want to reemphasize that we are still in a high transmission level. So please continue to be vigilant against this virus.
Thank you, John. So we've been doing these COVID-19 updates many weeks throughout this pandemic. And, on a given week, every week, something changes up and down, whether it's the number of positive cases we have, the number of people who are being hospitalized, the variant of the COVID-19. But one thing that's been tried and true throughout this entire pandemic are the CDC recommendations, again, to use facial coverings, to social distance, to get the vaccine, and to practice good hand hygiene. So, that is one message that throughout has never changed at all. I will now turn it over to John Scott, our Emergency Management Director, for an update. John?
Good morning. Thank you, Don. And again, my name is John Scott. I'm the Emergency Management Director for Brevard County. I just want to talk about a couple of items. Logan, if you'll throw up on the screen for us These are our testing locations that we partner with the health department on, also Parish Medical Center, County Parks and Rec, and the City of West Melbourne. Gives us good north, south, central, and barrier island coverage. The details for all 4 of those locations, which are Parish, Kiwanis Park, the health department in Vieira, and West Melbourne Community Park, which is right next to Field of Dreams, off Minton, down south. The details for them there are on the screen for everyone to look at. Again, testing is widely available through those locations. In addition to those locations, we know that pharmacies have availability, so that's CVS, Walgreens, Publix, all those folks, and of course, some primary care and urgent care centers continue to offer testing. So testing continues to improve in availability. So if you are someone who thinks you may be COVID symptomatic or COVID exposed, there are options to get tested. Additionally, if you are someone who is COVID positive or again COVID symptomatic and you don't want to wait for a test, you can go to the monoclonal antibody treatment center in Kiwanis Park and Merritt Island. That's open 7 days a week from 9 to 5. Again, you do not need a doctor's note for that. You can just go. We encourage appointments, but you can show up, get treatment. Again, that is 4 shots. It takes about 20 or 30 minutes to get you through the process, and then you're observed for an hour. I want to remind anyone, it's great to use it, especially if you are not feeling well and think you have COVID or are COVID positive. But the earlier you can get treated, the better, the more effective the treatment's going to be. So please don't wait. Go do that right away. Again, if you're not feeling well, it's Monday through Sunday, 9 to 5. Walk-ups welcome. So those are 2 big things that are out there as far as good tools in our toolbox when we talk about how we continue to work through our COVID process. The other one that you've heard from John, you've heard from Don, is continuing to use our good mitigation cycles and help us in the cycle of transmission so we can move from a community of high transmission, get below that threshold, and hopefully get us to a point eventually where we are a community of low transmission like John outlined. So I'll just remind people, equally important in all of that is if you are someone who doesn't feel well, if you're not sure if you have COVID or if it's allergies, whatever that is, please stay home. Please don't go hang out with a bunch of folks. Please isolate. Please try to keep that under control and limit your exposure until you know exactly if it's COVID or if it's something else. That makes a tremendous difference when we talk about spreading COVID versus helping us keep COVID under control. So please, let's all do our part. If we're not feeling well, please stay home. Don?
I want to mention that if you are having economic challenges as part of COVID-19, there is help available through the county. Our Housing and Human Services has money that it can dedicate toward rental assistance and also utility assistance. So if you would go on our website at www.brevardfl.gov, go to our Housing and Human Services department, and on their main page at the bottom, you will see an application form that you can fill out, and there is money available to assist those of you who need that assistance. For an update from Brevard Public Schools now, I'll turn it over to Catherine Allen. Catherine?
Thanks, Don. So really for the schools, the only new development that the public would need to know about is there is a special board meeting scheduled for Tuesday, October 5th at 9 a.m. And the board will be discussing face coverings and other COVID information and policies. The agenda for that meeting can be found on our social media channels as well as on our website. Those who would like to speak at the meeting, as always, you're welcome to do so. Speakers at this meeting will have 1 minute for public comment. If you can't attend the meeting, but you still would like to be able to follow along with it, it will be streaming live on the BPS YouTube channel as well as Spectrum Channel 496 as always. That's all we have.
All right, thank you. So with a shorter panel today, we're going to jump into questions earlier than usual. So I will turn it over to Jessie Ray. Jessie?
Thank you, Don. Okay, so looking ahead to the holidays and family gatherings and vacations, what should people be anticipating or be on the lookout for?
Well, again, we would encourage, as we talked about earlier, in public indoor settings, we would recommend facial coverings, And as John Scott mentioned, certainly whether we're talking about work or school, but particularly it applies as well to gatherings of a large amount of folks, to where if somebody's not feeling well, they should not attend. So these things still apply, and I would suggest keeping that in mind and doubling down on that during the holidays when you have a likelihood for greater gathering of folks.
Okay, thank you. So we've seen this pattern before throughout the pandemic, a surge followed eventually by a reduction in cases and hospitalizations, and then a few months later, another surge. Can we change that pattern, and if so, how?
Well, again, we can only control so much, but I would urge to do the things we know that work, not taking our foot off the gas at this point. We're not there yet. So I would encourage the public to continue to be vigilant, continue to follow those recommendations that we know work, continue to get vaccinated, continue to wear facial coverings indoors in public settings, continue to encourage hand hygiene. And again, if they're sick, take it seriously and stay home until you're feeling better, or seek testing to see if it's COVID or not. So I think if we continue to hammer those things that we know work, that'll definitely help us get over the hump.
Okay. The case positivity rate is decreasing, and as are hospitalizations, yet the death rate continues to increase. So between September 18th and September 25th, there were about 8 deaths per day, according to the CDC data. Why is that the case?
Well, a lot of times the deaths are reported when that information's available, so that may vary from week to week, depending on when that data was available to review and when it was reported by the various facilities.
Okay.
I'll also add to that, and state to always remember our hospitalizations lag by about 2 weeks cases, and the deaths lag by about 2 weeks for hospitalization. So if we're seeing increased deaths in September, that's probably reflective of the August cases.
Okay, understandable. What trends are we seeing in the new COVID-19 cases as far as the age of the patients, vaccination status, and other factors?
Well, again, the vaccination status has been relatively unchanged. In terms of the cases, we have seen an increase in younger folks by numbers. So that's been a trend that's been occurring since the increase in cases started late summer.
Okay. How much do you think the face mask policy implemented by Brevard Public Schools has played a role in reducing cases among students and school staff in recent weeks? And do you think the policy should remain in place?
As we've been saying all along, face masks are one of the mitigation strategies that we do need to be following, along with vaccinations and distancing and staying home if you're sick. As far as should the face mask policy continue in the schools, that's not for us to decide. That's for the school board to decide. They have data. They look at the data. They make the decisions. We implement the decisions that they make.
Got it. So we have heard that we think that maybe there's going to be another surge coming based on the pattern that we've seen. So what are we doing here in the county to ensure that we are prepared for another surge?
I'll take that, Jesse. So we continue to do everything we can to make all options available to folks. So testing is available. We continue to try to make sure we have wide availability in that. We've got the monoclonal treatments available, vaccines, which continue to be our best option here to get us to our long-term protection, are widely available. So our job is to make all of these resources as accessible to folks as we can. What we have as far as residents and community members, when I take my government hat on and I put that hat on as a community member, our job as the community is to take advantage of all of those things. So get vaccinated. If we're not feeling well, if we think we have COVID, we get the COVID treatments. We get tests if we think we've been exposed. We have a part to play here in the government side, but the larger, more important part is the part we all play as community members. The roles that we can take in that is not a passive thing. We can be active community members to get involved and stop this. The more folks who get vaccinated, the better we're going to be. If you're not feeling well, you either stay home or you get tested. All of that is going to help us keep our numbers down.
So, John, you're talking about all the things that can help us keep our number down, like testing, antibody treatments. How long is the monoclonal and testing sites, how long are those going to remain open, especially if we're seeing a decline in our numbers?
It's hard to speculate on those kinds of things because so much of that is partnership driven and private sector vendor partnerships. I can tell you that as long as there continues to be the demand for those, they'll be widely available and we'll continue to add resources. But as demand drops, we will then help our partners right size those operations so that it's available. So they'll continue to ebb and flow throughout this, just like they always have.
Okay. And you kind of mentioned supply and demand. Well, you mentioned demand. I'm going to mention supply. Are we seeing any supply issues when it comes to the vaccines, the monoclonal treatments, or tests for COVID?
No.
Okay. Excellent. And last question that I have for today, do we know how many COVID patients we currently have in our hospitals? Is that a number that we have available?
We do not have that at the Department of Health. That would be regulated by the Agency for Healthcare Administration.
Okay. That's all I have for today, Don.
All right,
Thanks.
Jesse. And Maria and John, I don't mean to throw y'all a curveball, but yesterday when I was driving to work, there was a radio station that was talking about the importance of getting flu shots. And in the same breath, they were talking about COVID, and they said you can get both at the same time. So I'm not sure what they were saying, whether they were saying you could get a COVID shot at the same time you get a flu shot, or if you can get COVID at the same time you get the flu. So can y'all speak on both of those subjects?
Well, certainly somebody can be infected by more than one virus at a time, and then that's always been the case. In terms of vaccination, yes, you can get them both at the same time.
All right, so if I get a COVID shot today, I can get a flu shot today as well? It's not going to, they don't counteract each other, so to speak?
Correct. Okay,
all right, good. Well, I'm glad we were able to clarify that. That ends our report today. Oh, I almost forgot, because it is hurricane season, I was going to turn it back over to John Scott for just a brief update. Today's October 1st, so still have 2 months left in hurricane season. John, the floor is yours.
Thanks, Don. And you're right, we still have 2 months left in hurricane season. And I know a lot of folks sort of try to take a deep breath. We've been really, really lucky so far. But again, I want to remind folks that October is actually our second busiest month. Matthew, which was in 2016, was an October storm. If you lived in the Panhandle, Michael, which was one of the worst storms on record, was an October storm. So we are not done with hurricane season yet by any stretch of the imagination. And I want to point out, climatologically, what happens right now is we begin to move from those storms that come off of Africa, where we get a long period of time to sort of get ready and prepare and watch what's happening. More and more storms are going to come out of, off of Central America and the Caribbean or in the Gulf, and they're going to move here faster. So we've got to be ready now so that if something happens, we can act quickly, we know what to do, and we can put our plans into place quickly and in a way that's going to make us most advantageous as we go forward. And again, I mentioned that we've been lucky so far. I want to hit on the idea that while we haven't had something, this has been one of the more active seasons on record. We have Victor out there currently, which means we have one more name on the list before we're now going to be moving to our backup names of the list. This will only be the third time in history that we'll go to backup names if we get that far. So we talk about hurricanes, we talk about busy seasons. Just because we haven't had it doesn't mean the tropics aren't busy, doesn't mean we can't have something in a week or 2 weeks or in 3 days. So let's be ready. Let's make sure we know what we're doing. We have a plan, we have a disaster supply kit, we know where to get good information, and we're ready to act. Don?
All right, thank you, John, and thank you for joining us today, and we will be back next Friday at 11:30 for our next update. Thank you.